10 early signs of pregnancy. Are you pregnant? Some early signs of pregnancy may show up around the time you've missed a period, or a week or two before or after. Pregnancy symptoms are different for every woman, and they can even be different from one pregnancy to the next. Symptoms start at different times, too. Some women feel early pregnancy symptoms within a week or two of getting pregnant, while other women may go months with no pregnancy symptoms. The only way to know you're pregnant for sure is to take a pregnancy test. Early signs and symptoms of pregnancy. Early pregnancy symptoms can be subtle. You may notice your breasts feel different when you put on your bra or that you're making extra trips to the bathroom. On the other hand, you may feel downright exhausted or unmistakably queasy. If you start to feel some of the early pregnancy symptoms in this video, you may very well be pregnant. Here are some of the first signs and symptoms of pregnancy. 1. Missed period. If you're usually pretty regular and your period is late, this may be the first and most obvious sign that you're pregnant. But if you have irregular periods or you're not keeping track of your menstrual cycle, other symptoms may be your first clues about a possible pregnancy. And some women feel early pregnancy symptoms before they miss a period. 2. Frequent urination. Shortly after you become pregnant, hormonal changes prompt a chain of events that raise the rate of blood flow through your kidneys. This causes your bladder to fill more quickly, so you need to pee more often. Frequent urination will continue, or intensify, as your pregnancy progresses. Your blood volume rises dramatically during pregnancy, which leads to extra fluid being processed and ending up in your bladder. 3. Fatigue. Feeling tired all of a sudden? No, make that exhausted. No one knows for sure what causes early pregnancy fatigue, but it's possible that rapidly increasing levels of progesterone are to blame. Of course, morning sickness and having to pee constantly during the night can add to your tiredness too. You should start to feel more energetic once you hit your second trimester, although fatigue usually returns late in pregnancy when you're carrying more weight, and some of the common discomforts of pregnancy make it more difficult to get a good night's sleep. 4. Breast changes. One common early pregnancy symptom is sensitive, swollen breasts caused by rising levels of hormones. The soreness and swelling may feel like an exaggerated version of how your breasts feel before your period. Your discomfort should diminish significantly after the first trimester, as your body adjusts to the hormonal changes. 5. Nausea and vomiting. Morning sickness can start as early as 2 weeks after conception, so it may be the first pregnancy symptom you notice, and it's not just in the morning either. Pregnancy-related nausea, with or without vomiting, can be a problem morning, noon, or night. Nausea and vomiting of pregnancy usually doesn't harm the fetus, says the American College of Obstetricians and Gynecologists, ACOG, but it can affect your life, including your ability to work or go about your normal everyday activities. There are safe treatment options that can make you feel better and keep your symptoms from getting worse. Pregnancy nausea may be accompanied by indigestion, food aversions, a heightened sense of smell, a metallic taste in your mouth, and excess saliva. 6. Implantation bleeding or spotting. If you're pregnant, you expect a break from your period, so seeing spotting or vaginal bleeding can be an unwelcome surprise, but it's not rare. About 1 in 4 women have spotting or light bleeding during the first trimester. If you notice light spotting around the time your period is due, it could be implantation bleeding. This can be caused by the fertilized egg settling into the lining of your uterus. Note, spotting or light bleeding during the first trimester is often nothing to worry about, but sometimes it's a sign of miscarriage or ectopic pregnancy. If your bleeding is severe or accompanied by pain or lightheadedness, or if you're at all concerned, call your doctor or midwife. 7. Cramping. Like spotting or bleeding, Cramping is a confusing early pregnancy symptom because it can make you feel like your period's starting. But you may actually be having implantation cramps, which occur when the fertilized egg implants in your uterus. You'll be able to tell it's implantation cramping and bleeding, and not your period, because it will be less than a normal period and last just a day or two. 8. Constipation. If you're newly pregnant, constipation can be an early symptom. It's caused by an increase in progesterone, which relaxes smooth muscles throughout the body, including the digestive tract. This means that food passes through the intestines more slowly. 9. Mood swings. It's common to have mood swings during pregnancy, partly because of hormonal changes that affect neurotransmitters, chemical messengers in the brain. Everyone responds differently to these changes. Some moms-to-be experience heightened emotions, both good and bad, while others feel more depressed or anxious. Note, if you've been feeling sad or hopeless or unable to cope with your daily responsibilities, call your healthcare provider or a mental health professional right away. If you have thoughts of harming yourself, call or text the National Suicide Prevention Lifeline at 988 or call 911. 10. Abdominal bloating. Hormonal changes in early pregnancy may leave you feeling bloated, similar to the feeling some women have just before their period. That's why your clothes may feel more snug than usual at the waistline, even early on when your uterus is still quite small. You can track these symptoms and more each day with the Baby Center app. When do pregnancy symptoms start? Pregnancy symptoms are different for every woman, and even every pregnancy. Some women feel the first twinges of pregnancy a week or two after conceiving, while others don't feel any different for a few months. In the best study on this question to date, 136 women who were trying to get pregnant kept daily records of their symptoms from the time they stopped using birth control until they were 8 weeks pregnant. That's counting 8 weeks from the first day of their last menstrual period. The results: 50% had some pregnancy symptoms by 5 weeks pregnant, 70%, had pregnancy symptoms by 6 weeks pregnant, 90%, had pregnancy symptoms by 8 weeks pregnant. The first sign of pregnancy was usually a missed period. The most common symptoms to follow were nausea and vomiting, fatigue, frequent urination, and breast tenderness and swelling. By 8 weeks pregnant, women reported some additional pregnancy symptoms: heartburn, nasal congestion, shortness of breath, lightheadedness, spider veins, itchiness, areas of darker skin on the face, abdomen, or areolas. Other symptoms that pop up throughout pregnancy include forgetfulness, dizziness, food cravings, increased appetite, lower back pain, diarrhea, headaches, rashes, glowing skin, hair and nail changes, leaking breasts, pelvic pain, sciatica, pubic symphysis, dysfunction, swelling, vision changes, hemorrhoids, clumsiness, nosebleeds, increased vaginal discharge. If you find this video interesting, please like and subscribe to our channel for more videos. Thanks for watching.